A woman should be who and what she wants. We support the multifaceted woman. The woman embracing many titles, undertaking different ventures, and building generational wealth. You are a Jackie of all trades, master of your empire. Enterprise Empress, you are an unstoppable force. Welcome, welcome, welcome. We are back for another episode of what we call Today's Jackie, where we interview women who are Jackies of all trades, master of their empire. Today we have Dr. Tanya Roman, and we're going to tell you a little bit about why we're bringing her today. Right, Nat?
Yeah, so Dr. Roman is the Director of Pediatrics for Community Health of South Florida, and we wanted to take a moment to talk about COVID safety and how to reintegrate your kids into the world with schools reopening and all of the things happening with COVID. And we thought, who better to have on than the expert that I work with every day at Community Health of South Florida. So welcome, Dr. Roman.
Welcome.
Thank you for having me.
Thank you for joining us, taking time out of your patient care, seeing the babies to come and talk to us and to share with our community a little bit today. We thank you for doing that.
I'm very, very excited to be here.
As you can see, we're so excited. I don't even think I introduced myself or Natalie for any new guests. So if you are new to the show, this show is all about the multifaceted woman, the woman who's undertaking many ventures, building generational wealth, and embracing many titles.
Yeah.
So I am your co-host, Sharon.
I'm Natalie.
And we're going to have a great show. So let's jump into it. Now, before we get started, we always like to ask our guests, what are all your different titles? Because even though you're a doctor, we know that you're a multifaceted woman yourself. So what are some of the other titles that you hold?
So especially for today's interview, I want to be seen as friend. Okay. Yeah. So I think that especially when it comes to this topic, yes, I am a doctor, but I want it to be real, and I really, really want to connect with everybody today. And so for today, I am your friend, and I'm excited for that.
Now, are you a mom yourself?
No, I'm not.
Good.
Yes.
So Natalie, yes. I'm not either. So Natalie, yes. So Natalie is going to be able to give us all those questions that mothers want to know for their kids. Yes. But you are a doctor for children,
yes,
right?
I am.
You are a
pediatrician.
Yes, correct.
Yes. The biggest question: how do we talk to our kids about COVID, especially people with little kids, right? How do they talk about it in a way that they understand it, but it's not scary or too much for them?
Yes, so that's a great question. The first thing is that there is no wrong way or right way, and how do you talk to your kids about COVID? But hopefully I'll be able to share a few little tips that will make the conversation a lot easier. So the first thing is to make sure that you create an environment where kids can feel very comfortable asking questions, sharing their feelings. That's the first thing. I think it's important, depending on your child's age and your maturity level, to be able to explain things to them in ways that they can understand. Smaller kids might ask questions, and you might want to be more, simple in your answers, but you also want to provide them reassurance that everything is going to be okay. You're safe at home. You're going to be safe at school. You can't really make promises. A lot of kids will read things online and they'll see a lot of things. You want to be honest about your what you're sharing with your kids, but you want to make sure that you're engaging with them and that you're open to all of their questions and concerns.
And that's a good one. You mentioned of the knowing your child and how they're talking to you, because you have some kids who are very sensitive and who are a little more emotional, and then you have some who get anxiety around the idea of fearful things. And so I was talking to a coworker, and she told me her grandson got COVID, and she said he is at home in virtual school now. They had enrolled him in virtual school, and the mom said, "We're gonna have to send you back to school." And he said, "Please, no, I don't want COVID again. I don't want to deal with that." Like, he was so fearful of the idea that he could get sick to that level again.
Right.
So if there is a kid that's in a household with someone they've seen get sick or they've experienced a loss, how do you talk to those kids who are like, I don't know if I should hug my teacher, if I should go to school. Like, I'm just so afraid of this. No one, scary.
Yeah, it is. It is very scary, especially in those kids that have had loss.
Right.
They've lost somebody in their family, a friend, or they've seen people or heard of people in hospitals. It can be very scary. So I think the first thing is to say, like I said, you're going to be safe. You're going to be safe going to school, but it's important that you do this and that, and we'll talk about that probably a little bit later about how to keep yourself safe and how to prevent getting sick. And if it does happen, it's okay. We'll take care of it.
Right.
We'll take you to your doctor and you're going to get better.
Right.
I think that it's important to reassure kids that it's going to be okay and that we're going to take care of it.
Right. I think that's good. You actually mentioned it. So let's dive into that.
Yes.
Like, what are some of the things that we can do as parents to keep our kids safe? And then the second part is, what are some of the things that they could do or have in place at school in order to keep them safe?
Yeah. So the first thing is, the decision about sending kids back to school was very, very important. It's crucial that kids are going back to school.
Right.
But in order for that to happen in a safe way, everybody has to do their part. Okay. So there's many things that can be done to make sure that your kids are safe and to create safe schools, per se. So the first thing, if your child is eligible for the vaccine, for the COVID vaccine, definitely recommend getting the vaccine. That is very important. The next thing, to make sure that your kids are wearing masks. Okay, so it's important to talk about it. Make sure you're wearing your mask. Make sure you wear it all times in school. Make sure you're washing your hands before you touch your face, before you take your mask off.
Right.
Little things like that. So just educate your kids, and they should be good.
And pull your mask up. I see kids all the time who are wearing a mask but it's down here.
Yeah.
It's like
Yeah.
it's like having shoes without the shoestrings tied. It's defeating the whole purpose. You're gonna still fall.
It's really hard, but I'm going to tell you, kids have been great with masks. Sometimes I think that many kids have actually handled it better than many adults I know. But if you teach your kids how to do it right, they'll listen to you.
Mm-hmm. Can you tell us what are the ages for getting the vaccine? Like, if your child is eligible, how do you know if your child is eligible?
Yes. So, and this will be changing in the next.
Keeps changing.
Yes. But currently, at this time, children ages 12 and up.
Oh, it's down to 12 now. So it was 16.
Age 12 and up are eligible for the Pfizer vaccine. Okay. So if your child is in that age range, it's definitely recommended. 18 and up, it could be any of the Moderna, Pfizer, or Johnson vaccines.
Okay.
And so if you don't know where to go, you can always reach out to us at Community Health of South Florida. We are giving the Pfizer vaccines in kids, and so we'll be more than happy to do that.
Now, I have a question about that, but I want to tell them that again. If you are interested in your kids getting vaccine, you said we can go to Community Health of South Florida, and they have locations in Perrine, Homestead, Cutler Bay,
South Miami.
Yes. Any other ones?
Yeah, those are the main areas. So on the south side of Miami-Dade County, basically from South Miami all the way to Florida City, there are 11 locations, and in the Keys as well. Yes, in the Florida Keys, Tavernier, Marathon.
And you can go to, what's your website to find that? Or
it's CHISouthFL.org is the website. Yes, and if you Google Community Health of South Florida, it'll pop up.
Yes.
Yeah, it'll pop up.
So I had a question about this. So we talked about parents who feel comfortable with their kids getting the vaccine.
Yes.
But what is some advice for parents who don't feel comfortable with their kids getting the vaccine?
So I understand completely if a parent is hesitant about it. And that's why it's important to talk to your doctor, talk to your healthcare provider, ask them questions, be comfortable about having conversations about this, because that way, you relieve any kind of fear you have or questions, and then you can make a better decision. But I think it's important to do that before you kind of shun away from it and say no. Just talk to your doctor.
I agree.
Talk to your doctor. Yeah. Go to the expert, not necessarily to Google.
Yes, no. You gotta be careful.
Or TikTok.
MedMD.
Yes, WebMD.
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 The information.
Yes.
Not knocking WebMD, but just saying it helps to also communicate with the doctor.
Yes,
right.
For sure. We are there to help. That's all we're there to do.
Yeah, I like that. That's so much better. My kids go to TikTok. That's their first resource for everything.
It's like a
Yeah. They go to TikTok, then they go to YouTube, and then they Google if they don't find the answer. But we aren't doing that for this. We're going to an actual licensed medical professional to get information. Okay, got it. Should parents still take their children for their annual physicals and immunizations with all that's going on with COVID, or should they stop until COVID has passed or whatever might happen?
Yeah, because sometimes I'm scared when I have to go to the doctor's office. I'm like,
how do you?
I don't want to catch it at the doctor's office.
And a lot of parents have been hesitant, especially at the beginning of the pandemic. But from day one, we have encouraged that parents bring their kids in for their annual checkups, make sure that their vaccines are up to date. Remember, it's not just COVID we have, and a lot of kids have other medical issues and needs that need to be addressed, and we don't want to forget about those things, So we want to take care of everything, and so reach out to your doctor's offices and ask questions about going, but really set up those appointments because it's very important.
Okay. And some can be virtual, but then there's some.
Oh, yes.
Because now the telehealth is so much more popular. But there are some things you prefer they bring a child in, right?
Yes, there are certain things that you can do through telehealth, and many doctors have been doing that. But there are things like vaccines where, you have to come to the center to do it. But right now, we have been from day one doing checkups and vaccines, and I think people are more comfortable now. But for those that are hesitant, set up an appointment and come in.
And everyone is adapting good practices. Like I went to CHI. Was that last week? And they make you sanitize. They ask you. They take you through this questionnaire on if you've been around someone that's have you been around someone that's been tested positive for COVID? Right. Have you been tested positive for COVID? And if you have any symptoms, they ask you, have you been tested? Like we need to see the copy of it, and then they give you a little ticket to show. So if when you go inside, if everybody doesn't look like they did the raffle, then that's a problem. If everybody like they entered in a raffle, then you're in a safe space to see each other. I'm like, what raffle are we in?
And we do that to be able to give reassurance to everyone that it's okay to come and it's safe and we just want to take care of what your healthcare needs are.
Right. That's good.
I have a question for you.
Go ahead.
So as a parent, I was thinking about this because I work with nonprofit organizations and we have out of school programming. And I thought about when parents and kids, I'm like, well, when I think of it, but maybe it's because I don't have a kid. I said, well, if you had pink eye and it's contagious, right? It's like, how are we going to do that? If one person breaks out, what do you do? Well, they're going to call that person, send that one home, inform the parents. It's like, oh my God, there's so much anxiety. And I thought about that. I was like, how is that even, that's the same anxiety you get if your child breaks out with pink eye. I mean, I know it's not, I'm talking about the idea of how they're doing the protocol. If someone in the class has pink eye, or if someone in the class, if you're in a daycare and they have, I think it's hands, mouth, and
hand, foot, and mouth.
Hand, foot, and mouth, right? It's scary, but they remove that child. They contact the parents, they inform them. You make an appointment with the doctor, and then the doctor works with you to do the best treatment for that child in their case, right? Isn't that the same concept, or wouldn't that give you a breath of fresh air to know, wait, when you really think about it, we have gone through this before. It's just that we're in the beginning stage of it. This must have been how it was with the flu, with those viruses, with those vaccinations, right? It's just that we were born where it was already established. Does that make sense?
I kind of get it. I think, though, that this is because it is so new and there's so many unknowns to it that it's scary. And because it's so deadly, the impact and the toll, I think is different than with the pink eye or even with the flu.
Yeah, we are dealing, like you said, it is new. And every day we're learning more and more, and we don't know what's going to happen tomorrow.
Right.
But yes, like you said, because it can cause so much, like death, like you were mentioning, then it is very scary. Now, fortunately, in children, the majority of cases are mild. And that is reassuring because, to know that the cases are making more kids sicker, and that would be something that we really worry about. Not to say that you can't get severe illness in a child, but fortunately they are mild. So that's something reassuring.
Right.
And keep in mind, I have to play devil's advocate and ask different questions. So I understand that pink eye is different from COVID, but we just want to make sure that we're asking questions that some people feel, but maybe it's not the popular thing to say, so they're not discussing it publicly. People are not answering that.
Yeah, and I actually just spoke with someone on my way here whose daughter is 8 and had COVID from being exposed at school. But she's like, other than the test being positive, you would not have known that her daughter had it.
Yeah.
But luckily, because she took her to get tested, she was able to put the protocols in place to, protect the rest of the family. Right. She's like, but it was, like you said, it was a very mild case. That she didn't have a fever, she did nothing, which was great. And then the 10-day course, and they all tested negative, so it was great. But it's still scary as a parent because you send your child to school and then you get the call and everything stops.
So let's talk about that. When they get the call, what do you suggest parents do?
So, of course, they'll tell them, oh, your child has been exposed to someone in the classroom. And, I think there isn't that easy answer, well, do I do this? Do I do that? If you're not sure, reach out to your doctor and say, my child was exposed. If your child has any kind of symptom that is suggestive of COVID, like a cough, congestion, runny nose, fever, get your child tested and then reach out to your doctor via phone because you can set up a telemedicine visit to discuss this. I think it's important that people not panic at first, when they hear these things. Like I said, because the majority of cases are mild, but you have to monitor for things that are worsening, like shortness of breath, a really bad cough, fevers that aren't going away. And again, if you're not sure, just reach out to your doctor.
So step one is don't panic. I'm sorry.
Panic, which is easier said than done.
Right. Because that's like the immediate response as a parent. Like, is to panic and then your brain kicks in later with all of the other things. But you're saying step one, don't panic. Just breathe.
Which I'm sure you want to protect your child. You want to do everything you're supposed to do. So I can see how they panic. But a doctor here says that is not helping the situation. So let's breathe.
Don't panic. Let's breathe. Yeah, you were saying something and I cut you off.
But what if they don't have any symptoms? Should you still get them tested if they're exposed to it? Should you still call your doctor?
So you should, in the sense that if it is positive, then you can isolate and you can protect the people around. Because if you are positive, then you shouldn't go back to school. You shouldn't be around people that are possibly vulnerable, that can get COVID. And so that helps for that reason. It won't make a difference as far as the treatment, because really there is nothing to do except for observation. But it does help to know as far as that isolation part and how it would affect people around you.
And what's the window with getting tested? So if you're exposed today, should you get tested today or should you wait a few days? How do you know?
If you're exposed, the recommendation is about 3 to 5 days.
It used to be 2 days. Now it's 3 to 5 days.
3 to 5 to get tested.
Okay.
So you wait 3 to 5 days to get tested. So that means your child is not in school that time.
If you're asymptomatic. Now, if you have symptoms, then you get tested immediately. But if you don't have symptoms, then that's the window. And then, because that's usually the time where most of the cases may have a positive result.
Okay.
And so, and after that, then, you want to make sure that you're isolated if you are positive.
Okay.
So for those bro girls out there who are very systematic in their thinking, so let's say I have a child. The school calls me and says she's exposed. Yeah, I'm claiming a she. She's exposed. Okay. I wait, if she doesn't have immediate symptoms, I wait 3 to 5 days to go get her tested. But within those 3 to 5 days, do I send her back to school or do I keep her at home?
No, you want to do the quarantine, which is basically to keep your child at home and to observe for any symptoms. But you don't want to send to school because there's that risk that the child has COVID.
And then what do I do as far as the other kids or the other family members in the household?
Yeah, so you would treat her or him.
She's a she. You
would treat her as if she had COVID, pretty much. And so you would take those precautions and, avoid the contact as much as possible. everybody has a different setup in their house, but you kind of do your best to try to kind of separate everything, make sure you're not sharing things or using the same bathroom,
wiping down,
wiping the handles, the doorknobs, things like that, just to try to keep that infection from spreading in the house.
So we kind of think of it like when we have someone that might have a flu in the house.
Yeah, and you want to wear your mask inside too.
And
a lot of people
mask.
don't think about wearing a mask inside their house, but that is a really good way to help prevent the spread.
Can you do these?
So these are not as effective because it's recommend that you have a mask that's over your nose and over your mouth if there's a suspicion, especially that somebody has COVID. So you want to wear that mask.
Okay, that's good to know. So then, let's say the baby tests positive.
Mm-hmm.
So the baby's positive. You go
She
through.
Tested positive.
Yes. Okay. She tested positive, and we go through the observation and the quarantining. At what point should we retest the baby to see if she's still positive or if she's negative, just to know what the next steps are?
Yeah. So typically, the what you call discontinuing isolation, where you can actually not be in that isolation, is about 10 days after the test was positive. Okay. You could choose to retest if you'd like, but typically 10 days after, and of course the child has to be asymptomatic. Okay. Once symptoms kick in, then it's a different story. But if you don't have any symptoms, 10 days have passed, then you are good to go.
Okay. And what if there are symptoms?
Well, if there are symptoms, then you have to start counting from the time you had symptoms. And then you do another 10 days, and then you retest. And so
it gets a little bit more complicated.
Which is why it's important to communicate with your doctor.
Yeah, and that's why a lot of these things we're talking about can be very complicated. They were very complicated for us to figure out.
Right.
Like information overload too.
Yeah, so that's why, and everybody has different situations sometimes. And so it's just like I said, always reach out to your healthcare provider so you can get the best advice for your child.
Okay, that's the key. And so I'm going to throw in a shameless plug because we both are employed by Community Health of South Florida in our full-time day jobs. Yes. If anyone does not have a medical provider, they don't have a pediatrician, or you don't have insurance, you can always contact CHI in order to get access to health care.
And that's not a shameless plug. That's a needed add-on.
Yeah, I just want to make sure that we put that in there.
Who need to know what they feel like they don't have the support because they don't have insurance, or they don't know which doctor to call. So that's why I'm grateful that you're here, because being able to connect with you as their friend today will give them positive motivation to reach out to you and reach out to CHI, and knowing that even if they don't have insurance, someone will cater to you is a good thing.
Yeah, still get the best care.
Now, what about babies who can't speak for themselves, who can't tell you what their symptoms are, who you can't identify them as clearly? How do parents deal with that? Kids that are in daycare.
Okay, so as far as actually having COVID, or are you asking
exposed to COVID, having COVID, like how?
Kids babies are trickier, obviously, because they can't say what's going on, and but mommies know. Mommy knows their babies, and when they know something's wrong, then they should always reach out and say something, because something can be wrong. Babies present similarly with the same symptoms like cough, congestion, runny nose. But fortunately, many have not, and that's very good, because the cases are very, very small.
Very small. That's good to know.
That is, that's good information.
Very mild, I would say.
That's good information. Yes. Is there anything else we need to know that we haven't covered in our conversation before we wrap up? Anything you want to share?
I feel very strongly about the vaccine. I think that is like the hope to be able to control this pandemic. And so if you've had the vaccine, I'm super excited that you did.
Kudos to you.
Yeah, I really, really do, because everybody has to do their part in all of this. And so if you haven't gotten the vaccine, if you're thinking about it, I really, really urge you to talk to somebody that knows about this, so that you can inform yourself and not be fearful. Take care of yourself, take care of others, because it is the single most important weapon we have to combat this pandemic. So I would really urge everybody to get vaccinated.
Get vaccinated. Perfect. And anything?
I do have something.
Go
it's kind of off, but on.
Go ahead.
And just for information, I noticed that when I first got COVID tested, I didn't see anything on my insurance. And then all of a sudden I started getting, when you go to the doctor, they send you something in the mail that shows, what they covered. I started seeing that now the insurance companies are covering. How is that? Like, has there been a change? Like now there's a copay, there's something involved, like your insurance is now covering the cost and sending you possibly a copay. And then if you don't have insurance, like if you have to get tested, are they still considered free?
So at CHI, our testing is free. I don't know if at other places they're charging other people, but in many places the actual test has been free.
And even the vaccine, I noticed they ask you for your insurance information. Are they charging your insurance?
See, the vaccine itself is free.
Okay.
The vaccine you don't pay for. What many times is the charge for the actual administration of the vaccine, and maybe that's what that is. The vaccine is free, and you won't be charged anything.
So if you go there and you don't have insurance, you can still receive the vaccine.
Of course, the vaccine is completely free, and you will not be charged for anything.
Perfect.
It's a public health.
Yes.
It's a public
right?
health.
Yeah.
So it's fine.
Oh, I'm so glad we got to talk to you. And I actually feel like I'm not even a mother, and I feel like I absorbed a lot of information in such a short time. And I don't know, since we have a few minutes, can you tell us, Dex, if anybody made a comment or any questions you want to? So Dex is in the room. That's our producer. Normally we are really fancy with a TV, but today Dex is going to call it out for us. So
we have safety is important. Stop sharing food and drinks.
Oh, that's a good one. We didn't talk about that because that's normally what kids do.
Yes, they do.
There's snacks. Can we speak on that real quick? Like how do parents remember to talk to kids about that? I think about that one.
Yeah, and it's hard because that's just very, very normal behavior for kids, especially the little kids.
Yes.
They see a good snack that a friend has and they just want to grab it.
Yes.
It's hard. Parents, like I said, you do the best you can with your kids and you tell them you only eat your food. You don't want to eat someone else's food.
Yeah.
I imagine teachers are having a hard time with that, but it's education. That's the only way to do it.
You're going to have to give air hugs. You're going to have to give air high fives and dabs. Like, don't actually
bump
dab,
elbows.
just like elbows. So that's a good one. Any other good comments or questions? I know we don't have time for all of them, but any ones that we could definitely help.
We have Florida judge in favor of school district imposed mask mandate. This should help our children. I got my vaccine at CHI.
Oh, good.
Good to know.
Yes.
Shania Johnson says, amazing show, amazing ladies, always a great show. Can't wait to see who you have on the next episode.
Well, thank you, Shania.
Great.
We appreciate
I think
that.
Next episode, we're going to be doing a piggyback after this because what happens is you're so stressed out about, should I send my children to school? Should they stay at home? And then if they're at home, you're stressed out that they're at home. So next week, we're going to discuss that mental health around having to make all of these decisions in this epidemic,
in the midst of this.
and how it emotionally plays a toll on your mental health, how it plays a toll on your mental and emotional health, and what things you can do, not just self-care for yourself, but self-care for your family, so that everything isn't always about, did you put up your mask? Don't touch this. Don't do that. Wash your hands. It's like, it makes me feel like when FCAT is coming around, or standardized testing, it's like poor kids don't know what to do. It's like, there's a test coming up, and they're like, I just want to go to school today. I can't. I'm so scared of this test. Yeah. And you don't want to live in fear in your household, or as a mom, or as a teacher or an employee. You don't want to live in fear. You want to be educated. You want to have the information and make the best decisions you can. And then what you don't know, that's what you were saying, Dr. Roman, is seek out your professional, your physicians.
Right. Yes. Go to the expert.
Go to the expert. Was there anything else you want to share with us, or any other questions, Dexter, that we should address?
We're good. Okay.
Thank you. But Dr. Roman, anything else you want to share with us? Tell us.
No, I think that, we need kids to be kids. We need children to be children, and everything that we're doing is for that. And so I hope, we have a better year. Last year was very rough on kids being at home. It was just really, 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 really hard for them. So hopefully things will be much better this year.
I claim that too. Things are going to be much better.
Things are going to get better.
So that means
get vaccinated.
Get vaccinated.
That helps.
That helps.
Get better.
That takes one stressful thing off of your mind.
Yes. It adds up. And can we just real quick talk about getting vaccinated doesn't necessarily prevent. Can you explain that? It doesn't necessarily prevent you from getting COVID.
Okay.
Can we just dive into that real quick?
So the goal of the vaccine and what it's been shown to be very effective is to help prevent severe disease, hospitalization, death. Okay. Yes, it does prevent majority of people from actually getting sick. There are what we call the breakthrough cases. And that's what a lot of people are talking about. Well, why do I want a vaccine if I could still get COVID?
Yes.
Those cases, and the majority of those cases, they've been very mild. And so that's reassuring. So the vaccine is important so that we don't have all of this, like I said, hospitalizations and death.
Okay.
And so that's really the goal of the vaccine right now.
Okay, now, I thought that was the last question, but I just realized there's one last
it's just we're trying to squeeze all of it out of you. We're trying to get it all out.
She's going to send us a bill. There's one last question. When we got vaccinated, it was based on the one strand. Now there's the Delta variant. Now there's other strands that we're hearing about around the world. Can you speak on that? Because that is why some people who finally felt like, okay, I'm going to go ahead and get the vaccine. Now it's, oh, Lord, you guys are going to all have to get new vaccine. Like, it's just so much around that.
Right. And of course, and that's constantly changing. Right now, the predominant strain in the U.S. is the Delta variant. What the vaccines, right now, Moderna and the Pfizer vaccines have been shown to be effective and protect against the Delta variant. Okay. And that's very important. Now, one thing or one other benefit of getting everybody vaccinated is that the less people have the infection, the less likely this virus will mutate or turn into something different. And we want to avoid that. That's another very important reason to get vaccinated. And so, we can all increase those rates in our community. We're going to be in a better place when it comes to that.
Okay, perfect. Thank you. That's good. That was a good question to end on. Thank you.
It was a feel-worthy question.
Dr. Roman, thank you for taking time out of seeing your patients today to come and share this knowledge with us. We appreciate it so much.
Thank you for having me. And if anybody out there needs a vaccine, needs a doctor, we're here for you. So reach out to us.
Yeah.
Now, do you have social media or anything where you ever give comments or information or anything?
I know with CHI we have.
CHI does.
Yeah, not me personally, but
CHI does.
So follow CHI.
So
so you're always updated on these kind of questions. And then communicate with Natalie and I. Like Natalie said, that's her full-time job. So send us messages, follow us on Enterprise Empress, share the show with other people. The more that people are educated, the more that the fear will start to release. So thank you for tuning in with today's Jackie Show. Remember that we want you to wear your crown.
And wear it well. Thank you, ladies.
Bye.
Bye.